hospital. So let's get an insight from Darren Hughes, the director of the Welsh NHS Confederation. Morning, Darren.
Good morning, Ollie.
In order to deal with this, you'd need to get an understanding of why it's happening, and this is something we've been trying to get a sense of over the past few weeks. Why have we had these outbreaks in hospitals, Darren?
What we're seeing is an increase in prevalence of COVID across Wales in communities. We know that it's a very highly contagious disease. It's also invisible, so what we're seeing is an increase in patients coming into hospitals with no visible signs or symptoms of COVID who unfortunately are carrying it, asymptomatic patients. We're doing all we can in terms of cleaning between patients, in terms of staff wearing PPE, huge amount of infection control measures being put in place, and I can assure everybody that staff are doing all they can to prevent the spread of this disease.
Yeah, the question is as to why that wasn't being done initially, and whether it ought to have been. It might have prevented a lot of cases, might have prevented many deaths, Darren.
It certainly was being done, but as I said, it's impossible to eliminate the spread entirely. They're doing all they can. What we're seeing at the moment is we've got around about 1,000 people in hospitals across Wales with COVID. We're already at the stage where our critical care capacity is full within Wales. The normal critical care capacity, we're having to supplement that. And we are at the stage now where we're starting to use the field hospitals. We've got 25 patients in field hospitals in the Cwmtaf Morgannwg area. So I think just to remind people that the virus is very much still with us, and our staff are working tirelessly to do all they can to treat and look after patients.
Do we have to accept that it's inevitable that once you get coronavirus COVID into a hospital, and that's going to happen because people go there seriously ill with it, that once it's in there, it will spread within the hospital? Is it inevitable that there will be a level of spread?
It's inevitable there will be a very, very small amount of spread, but just to assure people we're doing all we can. Hospitals are very much still open and very much still a safe place to be. I think the staff have been working tirelessly now for coming up to 8 months. Many of them have been personally affected by this tragedy, family members affected, but also seeing the harm that's being done by this virus on a day-to-day basis.
Yeah, I still don't quite understand why you're talking about a very small number of cases when, I mean, I can reel off to you what's been happening over the past weeks, and specifically at Royal Glamorgan, where 43 people have died, been 44 cases in Ysbyty Cwm Rhondda and Maessteg, 39 patients, 28 members of staff at Morriston. We've had an outbreak in Bronglais Hospital. You talk about a small number of cases, but we've been reporting widespread cases and outbreaks across hospitals across Wales.
One case is too many, and our condolences and thoughts go to all of the families and individuals affected by this. This virus is very easily transmitted and as I've said, can be invisible. Everything that possibly can be done is being done. We're seeing medical and health professionals working with on wards, but unfortunately there are outbreaks which are too many, but I can assure everyone everything that's possible to be done is being done.
And when you say that everything that could be done was being done since the beginning and over the past weeks and months, you're telling me that no extra measures have been put in place since these outbreaks then?
Since the virus came to this country around about 8 months ago, we're learning from it every day, and as we learn more, new and extra measures are being put in place. But it is a very contagious disease, and as we learn more, we are doing more. We know a lot more now than we did 8 months ago, and staff are doing all they can to learn from it and do the best they can for patients. I
asked the Health Minister last week whether, at some point when this is all over, if this is all over, or when there's a pause, when the time is right, if there's a case for having a look into this to see if lessons were learned quickly enough, if measures were put in place swiftly enough, if things could have been done, should have been done sooner, which might have saved lives. What do you say to that, Darren?
I think having an inquiry at the right time is absolutely vital. I think Welsh Government have agreed to it, UK Government have agreed to it. We've never seen the NHS face a challenge like this in anybody's lifetime, and there obviously will be learnings and things we can do better next time. So very much support an inquiry, and as I say, we are learning day by day more about this virus. And just to remind everyone that we've all got a role to play in keeping the spread of this virus under control. 1,000 people in hospital at the moment, the virus being widespread in many communities. We understand the challenges that people are facing, huge effects with the lockdown now on people's mental health and well-being, but we've all got a role to play to ensure that the NHS can cope, not just with treating COVID patients, but patients with other serious conditions. And please don't estimate how much of a challenge this is for the NHS.
And just very quickly down at the end, how close to critical are our hospitals now?
We're very well prepared, but as I've said, the normal critical care capacity is already full, so we're having to supplement that. There are 5,000 extra beds sort of in reserve to deal with winter pressures and to deal with the virus should we see a resurgence. But we've all got a role to play, keeping our distance, good hand hygiene, working from home where people can, and wearing masks indoors. We need to do all we can. Staff have been working tirelessly now for 8 months, struggling to provide care. Social care workers across Wales, home care workers across the Thames, across Wales, we've all got our role to play in helping beat this virus.
Thank you very much. Thank you. Darren Hughes, the Director of the Welsh NHS Confederation, with us on BBC